So, good morning everyone. Welcome in the next season of our research breakfasts. First of all the best in the new year. I'm happy that you find a way again to the campus library. And today we have a very, very special guest who found an hour in his very tight schedule to spend it with us, and the special guest is Martin Repko, our dean. So Martin, welcome and thank you that you joined us.
Good morning.
Good morning. So we've got about an hour to just chat. we got some topics that we would like to cover, but basically we want to share your story. You are many personalities in many roles. You are a musician, yoga master, chopper driver, spine surgery expert, and definitely second term serving as a dean of the Medical Faculty of the Masaryk University. So, Martin, could you share with us your story? What motivates you to get here?
First of all, thank you so much for my invitation. I really appreciate it, and thank you for coming today to this place, which is very important for us to be in campus together. And thank you so much for getting the opportunity to speak with Tomáš and with you. This is my first interview with psychiatrist, and hopefully,
confirm.
Hopefully the last one. But we know together with Tomáš so long, and I could say we are the friends, and it's my pleasure to be with you today. I'm not sure what kind of history of myself are you interested in. But I will start just slowly and shortly about my history, which is quite easy and not so probably interesting for you, because I was studying in Masaryk University. Previously, it was just in the old buildings in the center of the city, and I just graduated in 1992. It means that I just spent some time in the university during the past time, in the communist time, and in the new time after the Velvet Revolution, which was really something very interesting for us to spend there. Anyhow, it was the time when we started with the military service in that time, because it was like the cathedra of military at that time. And it was funny to observe as well the people, what they said at that time, but was a nice time. I think many of you are just also remembering that time. And my story is quite easy, because after the graduation, I just got the opportunity to work in the orthopedic department here in the Faculty Hospital in Bohunice. That time, the Professor Vlach was really somebody who was really guru for spine surgery, because he was the first one who just did the spinal surgery that time in Czechoslovakia that time. And I was really impressed by him, and I was really very nicely introduced to the spinal surgery by Professor Otto Vlach. And this was very nice time, because definitely, I was interested in anything what could be done just in the spinal surgery. And then I continue with my other steps, like PhD studies and associate professor studies, and so on. And nowadays I'm trying to just deal with both categories of the work, like the category of the work in the hospital, and I'm very happy to be as well with you serving as a dean of the medical faculty since 2019. That's really short story.
A short story, but you are very humble. You omit a lot of things, so I will get it out of you. So you said that you met Professor Vlach, and so it was an important person in your career to meet someone who's inspiring to choose your specialty. Yeah, who was he like? What was he like that he got your attention and you wanted to be like him?
He was a great person because he was the first one who just started with the spinal surgeries in Czech Republic or Czechoslovakia at that time. And he established a new department. First of all, it was department just sliding from the first orthopedic department in St. Anne Hospital. First year was like just only department, and then next year in 1977 established like a clinical department. And then in they moved to the Faculty Hospital Bohunice, and they started to do the spinal surgery as well, but not only spinal surgery. We are complete orthopedic department. It's funny because this year we started the new era of the clinic because we switched with the name from orthopedic department to the Department of Orthopedics and Spinal Surgery, which is very unique in this country because no clinic, no department are able to do both sides of these specialties. That's why we are doing as well all kind of orthopedic surgeries as well all kind of spinal surgeries, which is very unique for this country and especially also for European or worldwide countries, because usually when I'm trying to do both still. Let's say I'm more or less focused for spinal surgeries, but trying to do still some arthroplasties. I'm not able to do arthroscopy procedures. I don't know how they are dealing with that, but I still living with the arthroplasties. And when I am coming to any country of the world and speaking with my colleagues there and saying them that still I'm doing some kind of arthroplasties, they are a little bit saying, okay, okay, let's do what you would like to do. But mostly the people are doing either the spinal surgeries, either the orthopedic surgeries.
We'll touch on that a bit later about your international activities, but let's get back to the apprentice years. You had the opportunity as a medical student to meet Professor Vlach and to see his work, that it inspired you, that this is something that you really want to do?
My let's say research work started in biology department. That time was Professor Šmarda. Now it's another one faculty in the center of the city. But that time the biological department was there, and I was starting with some essential research there with all biological department staff and so on. And then, because that time I was really somebody who was interested in sports and so on, and I was attracted by orthopedic surgeries and so on, because it's usually very common to do. And that time I was starting to think, okay, I would like to be an orthopedic surgeon. And I was starting to cooperate with Docent Miller that time. It was like the 5th year of the study. And Docent Miller was the pedagogic person who was teaching us in the orthopedic department at the time. And we started to collaborate in some essential research on the spine, on the scoliosis, because the scoliosis...
It started in those days.
Yes, in those days. And I got some duty from him to collect some patients, the data of the patients, and make some essential work, research work on clinical way. And then I was starting to think, okay, I would like to work on this department, because I was inspired by many people there. But there was not so empty space that time. Nowadays, it's quite easy to get some position in all departments, not only orthopedic. And that time it was not so easy. And I was starting to think, okay, I need to start in some small hospital outside of the Brno. But nobody would like to get me there. And finally, it was funny time. I was traveling around the Moravia and so on, and nobody would like to get me. I don't know why. And then I got some opportunity to start in the Children's Hospital in the orthopedic department. But finally, Professor Vlach just sent me the not email at the time, because email was not something what usually
Pigeon.
Yeah. He sent me the letter that I could be accepted to this department, and I was started there. I was the youngest surgeon that time, about two years. That's why I was treated by all the colleagues, and I got the opportunity to do anything what they don't like to do. That's why it was not so easy time that time, but I was really happy to be in the department. And Professor Vlach was really very distinguished person, who was very distinguished around the whole country, and that was nice time to learn from him, not only the specific surgeries, but the complex leading of the department, and he was really great person.
Yeah. So great that you had the opportunity to meet him.
Yeah.
I really wanted to ask you about your beginnings, because I know that you in your department are creating opportunities for students who are interested in orthopedic surgery to participate during their studies, during your clinical work and surgery, etc. So do you see it an important way to attract new colleagues and to show him what the art is actually, and what to expect, and select the best?
Oh yeah, that's true. I think that the most important thing is to be inspired and to be really to want to do something like this, like orthopedics. Because if you are not interested in this field, it's something which could be very problematic for you, because otherwise for the first years you are not so involved in the surgeries. You are involved like the assistant, but to do some surgeries like independently, it's quietly not so easy for younger colleagues, and that's why if you are not so interested in orthopedics, could be a little bit problematic from the beginning. But for me, I have some colleagues who are, or some students who are just interested to be the orthopedic surgeons during the studies, and they are coming to our department to see some surgeries. We are involving them for our work, and I think if you would like to be, it doesn't matter if you like to be orthopedic surgeon or psychiatrist, probably it's good to start with the interest just during the study. This is most important thing, because you can choose. Because if you will see that this is something which is not so for you, you can just choose another one specialty for you. That's why for me it's very important to inspire our colleagues just during their usual practice in our department, which is 1 week for the 4 years study. Is usually, and if somebody is interesting to be probably the part of our group, that they can continue with their voluntary service for our department.
So you are open to that they contact you and you try to involve them. Yeah,
and we are getting some contact from students, and not only from the students from Masaryk University. We last year we just get the colleagues from the Slovakia, which graduate on the Slovak Medical Faculties, and that's up to them.
Yeah. So if you have the opportunity to sell your subject, what's so interesting about that? Because from my point of view, there's too much blood and too much physical exercise, etc. So what's so inspiring and motivating in orthopedic surgery and spine surgery?
I think that the main point is that if you are interested to do some surgeries first, because there are a lot of surgical different specialties. You can choose between the general surgery, urology, gynecology, orthopedic surgery, and so on. This is the first if you are just looking forward to do something like this. The second thing is that you are a little bit manually skilled, and it maybe somebody starting to do something during the childhood to play with some Merkurs and Legos and so on.
And legs of...
legs. Unfortunately, my children are not interested to do medicine, but I started with my grandson now. He's now 2 years old, and trying to put him some smaller models of the bones and so on. And my daughter is not so happy with that. But
good luck.
That's why I think you should be inspired a little bit from the childhood. If you would like to do something with your hands and to be a little bit skilled in this manner. But I know as well some surgeons who were not so skilled, but...
don't say that.
in the beginning. But during the practice, they just grow up.
Yeah, they grow up.
That's why it's and the orthopedic surgery, let's say, because the spinal surgery are done by orthopedic surgeons and neurosurgeons and sometimes trauma surgeons. That's why it's only some part of this. And usually when the young colleagues are coming to our department, they are starting with going through all these specialties inside of orthopedic and spinal surgery to see what they would like to do in the future. It's not only that you are coming, okay, I would like to be spinal surgeon. Probably not. Probably you can be some arthroplasty surgeon or something like this. That's why in the first years, like 2-3 years, they are just circulating through all these specialties and trying to find their own aspect. And on the other side or other view of this, the orthopedic surgery is not only surgery, but orthopedic is the general specialty. If you are just saying, okay, I don't like to do any surgery, you can do ambulances independently on the hospitals and so on. That's why orthopedics are very, let's say, very popular because you can choose between the surgery and
so many careers within
medical care.
Perfect. So I can imagine it must be very rewarding, immediately rewarding. So when you start an operation and you immediately see if it was successful or not, and you had the job done, and you don't have to wait 20 years if something happened or not. So
usually it's two views again. Either you can choose or you can make some own picture of you if you are able to do, or somebody can say you to do.
Okay. Again, a humbler answer. You already said that you have contacts with many colleagues abroad, and I know that you travel around the world to teach the technique of spine surgery. So you saw a lot in different countries. So can you compare how the medicine is done in, let's say, in more developed countries, or let's say in Western countries compared to us, and less developed compared to us? Is there something that you could highlight?
Just in the beginning of my real big practice, I think, because it's quite a long time, then you can come to the surgeries like deformity surgeries, because it's like the top 4 surgeries for us. And I was before the associate professor degree, and I was thinking what to do, where to learn more. And I spent two months in the St. Louis in US, because that time Professor Lely Lenky was really the highest person who just was the most distinguished person for deformity surgeries. And that's why I realized, okay, it will be the best way to learn something from the higher person for this. And I spent there two months. And it completely changed my view of the surgeries and so on. And I started with the surgery like him afterwards.
Wow.
And it was funny time as well, because I was only one who was there so short time. Usually the Korean, Chinese, and Japanese colleagues are spending there two years. And when I came to St. Louis that time, they asked me, okay, how long will you stay with us? And I said, okay, 2 months. Or they said, okay, that doesn't matter. What would you like to learn from him? But then I started to do some special techniques with the transpedicular fixation that time, all the way, because before we used some hooks, some wires, and so on. And these techniques was like the most improvement in this teaching for us. And from that time, I started to do this technique, and they asked me to come to other countries to teach them. Let's say I spent some time in US, and then I spent time more to the east. It's the collaboration between the universities as well, or independent surgeons as well. And also, it was the question of the some specific industry companies, because we use some specific instruments. For each and every deformity, you need to do some specific instruments as well. And these industry companies as well asked me to, okay, could you teach the people how you are dealing with this? First of all, they sent some surgeons to our department, and we got the surgeons from 35 countries worldwide. Last 15 years. And then I was asked to come to some specific places. The first place was Georgia.
Georgia, wow.
I was thinking, why Georgia? And then they said me, okay, we need to do the skilled surgeon, but we need to get some surgeons who are able to speak Russian, because they were not able to speak English. That's why I started to go regularly and frequently to Georgia, to Tbilisi, and started to do usually 3-4 deformities per 3-4 days. And then I did some surgeries worldwide, like I spent a lot of time in Poland. We just really do many surgeries, mostly in some all the cities of the Poland I know from this surgical time. And then I spent some time in South Africa, which was very nice to see. And regarding your question, what is the quality of the treatment there? It's completely different place to place. Let's say in Georgia they started with the independent hospital. We started in the University Hospital, then the people are moved to the private hospital, and we did quite nice surgeries there. But in the beginning, we need for some surgeries the X-ray control. And we usually do with C-arm. It means that you are just making the surgery, C-arm is coming, making the picture, and you can see on the screen how it looks like. And the first time they asked me, okay, you need really the X-ray? I say, okay, I need. Then they just call some boy who just bring the film, put to the patient, and running some other part of the hospital, and after half an hour we got the picture. Wow. That's why this is some complications. Technology. And regarding my experiences with South Africa, it was interesting because the quality of the care is very variable there. If you are just making in some private hospitals, the quality of all the instruments and so on, the stuff is really something very high. And it was quite easy to do, but in some places in South Africa was quite complicated to do. I remember one my story from the time when usually we have some sterile operating theaters. Each another are just boarding by walls and so on. And in South Africa, they got some big hall with maybe about 50 operating tables, and the surgeons are standing just together.
Open space.
Open space, yeah.
Okay.
It was funny, yeah, it was funny. But I have good remembering of South Africa, very warm people, very friendly people, and was very nice.
Yeah, thank you. So you said that you learn advanced technique in the US and then bring it back home and across the world. So my question is, who is the driver of innovation in your field? Is it the surgeon? Is it the industry that brings a new instrumentarium, or what? How to proceed further?
That's a great point. That's a great question, because usually the orthopedic surgery, especially the spinal surgery, is very technical surgery, which using a lot of instruments, a lot of specific instruments, implants, and so on. That's why our point of view and the most interested point is to make the stable and very safe implantation implants for these patients. That's why in that time, usually it's about the surgical techniques and the implants. These are two things. First of all, you need to be skilled surgeon to do good techniques, but you need to use the sophisticated and very good implants. That's why when you would like to do or improve the surgical technique, you need to get some good persons who can teach you. Like I got the Larry Lenke there at that time. Anyhow, the Larry Lenke, it's a good story because he was in St. Louis, and then he was bought by some private hospital to New York, and they said that it was like transfer like for NBA or NHL. They got a so nice. I got Milan Filipovic here, my colleague. We spent with him 2 days last year, and he's just the center of the interest of the hospital, and anything other like psychiatrists and neurologists are serving him.
Just keeping him stable.
And that's why you need to get some good person who will teach you how to do the technique. But as you mentioned before, the industry is very important for us because they are producing the implants. And they are also dependent on us because we would like to inspire them, okay, we need to get the implant like this shape and this strategy and so on. That's why it's very important. And like in our department, we are involved in the many innovations in this way. Let's say our last innovation is with a company called B. Brown, who are just starting to do the new implants. And they just asked us to start with some specific tests, which should be done on the cadavers and so on. And we are trying to say them, okay, we need to do the implants like in this shape and in this manner and so on. That's why we spend a lot of time with the industry, just only making the innovation with the implant, starting
design
with design, putting to the cadaver, starting with all these things. And then we were like with this instrumentation, in a way, we were the first one in the world who just use it for the clinical use. That's why for the first patients and so on. That's why this is the long story, which takes years, not the months or weeks, but years. When the safe and effective instrumentation you can just put to the patient. That's why we are still on the way with this instrumentation, and we try to use it for patients. Okay, something is good, something is not so good in the clinical use, and again we are coming to the beginning and starting to innovate or to make the design of this to be better.
So there's a lot of opportunities for collaboration with industry.
Yeah.
However, we are entering an era of regenerative medicine, and there's also, I believe, a room for collaboration with material sciences and etc. So, and we are entering the era of 3D printing. So, what is the, let's say, near future for your field? What will the new technologies, do you envisage that the new technologies will change your field completely? Like, for example, radiologists wouldn't be needed in near future because of the AI. What about the surgeons and spine surgeons?
That's again a great question, because we as a surgeons are a little bit afraid about the robotics and so on, because who will just replace us in the time? But hopefully not. And the question is good, because just from my point of view, one level is that who will do the surgery in the future? Because nowadays we got some navigation systems, which makes us a little bit more precious with the surgeries and so on. Now it's starting the era with the robotics, which makes still the robots in orthopedic or spine surgery is not so who is doing the surgery, but just showing the way how to put the screw, let's say, spatially to the spine. And this are two things, and also the AI is coming very quickly to our...
Even into your field?
Yes, yeah? Yes, because AI is something who can just advise you, okay, this deformity could be corrected by this manner, because they can read much more better the specific situation in the X-rays and CTs and MRIs and so on. That's why this is the first what will definitely improve the surgeries in the next maybe months and years, not decades. And the second thing is that, from my point of view, it's very important to perform the custom-made instrumentations, because now you are getting some general instruments, general screws, general plates, and so on, and you are just putting to the specific patient. Probably the future of these implants and so on will be the custom-made, and getting the big possibility to just to adapt the instrumentation to the patient, not the patient to the instrumentation, which is very important.
Yes.
And the third thing, which you mentioned nicely, is the regenerative medicine as well. And this is something which will probably in the future just reduce the necessity of the surgeries. This is very important.
In what way?
Good point. We have two projects the last 5 years. First project was just focused for the 3D printing, as you mentioned before. And we try to, because usually what we are doing is to get together two vertebrae in different diagnoses, like degenerative or deformity and so on. And we need to just make the fusion between two vertebrae together. And nowadays we are using the not custom-made implants between two vertebral bodies. And in the first grant, which we just finished last year, and Leos Benag is also sitting here. Thank you for. He is the student of our Masaryk University Medical Faculty, and he was a really great person who did a lot of work for this. And in cooperation with Aleš Hampl from the histological department, and from Sejtek VUT, docentka Částkova, we try to find a way how to customize the instruments. Means the cage which is putting to the between two vertebrae should be customized for each and every patient first. This was the first step, because this is usual way nowadays. But our innovation was that we put inside the stems, the germ stems, and making the possibility to grow in. Because it's the problem that some patients are not just coming with the instruments inside. That's why they are not accepting the instruments sometimes, or the fusion is not so solid for these persons. That's why we found some way, thanks to Aleš Hampl and many colleagues from this histological department, how to make the solid fusion by incorporation these instruments inside, which is very unique nowadays. And from this point of view, I would like to say that the cooperation between the clinical departments and preclinical departments is very important for us. And other things what we are doing now, it's about the regenerative or the early diagnosis of the deformities, is that we're trying to find a way in some idiopathic illnesses. Because like scoliosis in children, it's still idiopathic. We don't know what is the origin of that. That's why we're trying to find a way how to prevent the deformities itself. And we have very good cooperation with Ondřej Slabý and biological department and trying to find some specific markers in the blood of these children compared to the health population of the children. Because who will find the origin of the scoliosis, idiopathic scoliosis, will get the Nobel Prize, definitely. And we would like to get.
Okay, fingers crossed, yeah. You are very close, I believe.
Probably not, but some small step in this way we would like to show to prevent this. And this could be prevention of the surgeries, which are like not so good for the children because you are fusing some part of the spine. That's why if there will be any way how to decrease the number of surgeries, we are not so bloody one. And we would like to offer this possibility to our patients.
Well, that's amazing. And again, you were too humble to omit mentioning that you received a special recognition of your research by the Ministry of Health last year for the best research in the field of musculoskeletal medicine. Yes, so congrats again. And
that's the teamwork.
Is something. Yeah.
That's the teamwork, and that's why I especially mention also Leoš and other. And Milda Filipovic is also the person who will try to help as much as possible. And we were very happy to get this prize, but you know. What is the prize? Prize is nothing compared to the help to the patients.
Yeah, again, perhaps the Nobel Prize would. But let's wait for that. You said an important thing that the collaboration with the preclinical or basic research is essential for you. So, what is the role of a clinical scientist in collaboration with the preclinical or basic science?
I think that both separately are nothing, because the clinical should just inspire the preclinical. We need to get this way or to these possibilities to help the patients.
So you are bringing the questions and problems.
Yes, and we are not so, let's say, able to do the basic research because we are mostly, let's say, a little bit closed in our clinical work. And also not so sophisticated in the laboratories work and so on. That's why, as I mentioned before, separately, both these entities are nothing. That's why the clinical usually starting with the idea. Okay, we have patients like this, and we need to improve the either surgeries, either regenerative medicine, because let's say the regenerative is very, very popular nowadays, and starting with the cartilage problems. Cartilage is the tissue, only one tissue who has no vessel in nutrition, and that's why if the cartilage either in the joint or any part of the body is damaged, then is there no chance to repair automatically or separately or by own way. That's why this regenerative medicine cartilage is very popular nowadays. And again, we are starting to say, okay, we have these patients with this kind of problems, and we would like, we are able to do this and this surgeries or this and this treatment methods, and we would like to improve in this way. And they said that's okay, this is possible or not. And if it is possible, then collaboration is starting, and we are starting to make the preclinical testing, and from the preclinical testing we can move to the clinical view. This is the main point which we would like to achieve. Not only to stop in the preclinical part and to say, okay, this is possible maybe, but we would like to apply again back to the clinical practice. That's why usually it's starting from clinical point, but the main work usually is done by the preclinical part, and then ideally it's coming back and applying to the real medicine. This is the way which we are looking forward to get.
And what do you need to get it into the clinical practice? Do you need a partner, from the industry, or is it a place for a startup or something like that?
Yes. That's also a good point, because if you are thinking about the new implants, you need to get some industry partners, because we are not able to do the producing the materials and so on. Why to do? But if we are thinking about some regenerative medicine and so on, it's quietly more easy for us to apply without any industry partners. We have good just connection with many industry partners as well in this way. But let's say the good point or good example for now is the creatic, because creatic is something which is very great. And they can produce some new technologies and new treatment methods and treatment issues and so on, and they can just put it into the practice. The other point is the SUCL and other let's say department. The national institutions who need to give you some possibilities or the
permit
certifications to apply this. This could be a longer way than to observe something. That's why we should think not only about the theoretical part of this, but we should need to put to the real practice, and also the patents and so on is very important. And from this point of view, it's a very good point that in the Masaryk University is just very nice established the
transfer
transfer technology unit, which can be very helpful to you to get the patent and to put it to the real practice. That's why we need to get not only the idea, not only the partners for this, but we need to find a way how to put to the real clinical practice. And this could be very helpful as well, the CTT and other institutions like this one.
Perfect, thank you. So it seems that you are quite a busy person. When you
I have good colleagues for that.
Good colleagues. There was a question about how do you maintain a healthy work-life balance, but do you want to touch on that?
I don't look so working balance good.
You are looking very happy.
No, it's good point. First of all, I have a very good team. I have very good colleagues, either in the department, either in medical faculty, either in university. This is very important to get good colleagues and good cooperation with them. That's why one person is nothing in this way. That's why if you are just only thinking about yourself, you will not achieve this goal. That's why for me the teamwork is the main purpose, how to get this. And about 35 years ago, I started to the own inner research of myself, to work a little bit on my mind and body a little bit, but trying to be happy in my life. Let's say it's not so easy sometimes, but not to be just unhappy with what I'm doing. That's why all of what I am doing, I'm starting to be happy with this and to be to be in positive mind to do. Otherwise, it doesn't matter if you are doing something like this. Then if you are not so happy with this, then it's not so successful for you.
That's a great motivational talk. Is yoga the way for you?
Yes, yoga is the way for me. I was much more able to do more exercises by the physical way when I was younger. Nowadays, I am trying to motivate my patients to start with any activities like this. Like each and every Monday, I have my yoga course for yoga lecture for back pain. And it's interesting for me, just not only the body, but how the mind is active in the health of the person. That's why usually we are about 50 people. Let's say 20 are coming presently, 30 are online with this, and trying to combine not only the physical exercises to improve the flexibility of the spine and making good muscle balance, but it's getting very nicely psychosomatic effect in this way. And we are combining with relaxations and with breathing techniques and meditations and so on. It makes sense for me and my let's say, past patients, because these people are usually coming to you and saying, okay, I have the back pain like here and there. I'm saying, okay, here I'm not the orthopedic surgeon. Here I am like your yoga teacher. And they starting to do something like this, and they are balancing themselves by the mind and body and so on. And usually they are more happy with their bodies than before.
Yeah, we are just one.
Yes.
Body and mind. Yeah, that's nice to hear it from the orthopedic surgeon.
That's why I'm saying that we are not so bloody one orthopedic surgeons only, that we are trying to help the people in many ways.
Yeah, perfect. One area I always ask my guests is, you have a lot of international experiences, and my question is there something that holds us back to perform better in terms of medicine, in terms of science, in terms of what we can do in our fields?
First of all, I would like to say that we should be proud of us, because we are not so bad like we are thinking about.
That's great.
I don't think so. I really traveled through many countries, and I realized that many departments are doing not so good like we are doing. Like means not only the orthopedic department, but the system of the care, of the medical care itself. But on the other side, probably sometimes we are too much focusing for the clinical practice. And as I saw, especially in the US, they are just trying to just make some time also for science, or for some teachings and so on. And this is something which could be a little bit changed in our minds, that not only the clinical practice is the top, it's the top. What we would like to do, but also the combination of the science, research, teaching, and so on. It should be in balance. And for this, we need definitely to get some conditions. And sometimes it's not so easy in the hospital, because there is a lot of work, and we are trying to make the surgeries and treatment for many patients. But sometimes we are not so motivated to do the research on that. And the research and the teaching as well, ourselves and other people, are just pushing us forward. Because we should stay with open mind. If you are just closed in one technique or in one field, what you would like to do, you after some time you are starting to be very blinded. That's why sometimes it's good. Let's say I'm not so able to travel so much, because before COVID, before my dean era, was much more traveling. Let's say maybe 1/4 of the time I was spending outside of the country.
That's a lot.
But nowadays it's not time for that. But what I would like to do, and what I'm doing to do, I'm trying to push my younger colleagues to go somewhere to the places who are just doing, from my point of view, good work. And asking them, okay, come back and change anything. Just don't see to me and say, okay, we will do your technique. Just start with the another one. What you see somewhere. As I was inspired in the US by Levi Lenky, that is something which we should not be just close to one technique and just this is what we would like to do the whole year, the whole area of my treatment.
And this is essentially the role of University Hospital.
Definitely.
To bring new ideas, new techniques.
Yes.
To
And not only the hospitals, but also the university and faculties and so on. And this collaboration is very good. Let's say the the hosted professors and hosting professors is very good point of view to get some new new inspirations and so on. That's why finally I would like to say, don't be close to the whole life for only yourself itself, but try to be inspired by other colleagues.
Yeah, and it really worked for you, in the US, and so it really is worth doing that. Could we speak a bit about your dean service? What is it to be a dean? What is it like?
You know, it was not my dream. It was
That's
not my dream in the beginning, and I was not working on that hardly to be a dean. But many things were coming to my life just from somewhere. I don't know why. It's like my karma in this way.
Yeah.
And I was starting to be a dean in 2019 when our actual rector, Martin Bareš, was just established as a rector of the university. And I would like to continue with his work because he did very nice work for medical faculty, even in short time, but he did very, very nice things at this time. And it was I'm not sure, you are my colleague in this way, my statutory person for the dean. And I think that there are two little bit different words. One word is the hospital world or clinical practice, one word is the faculty and the university. And it was so inspiring for me to get together these two words, because it's very important not to separate we have the corridor between the hospital and faculty.
Important point.
And it's like changing the mind. When you are just going through the corridor and now you are coming from the hospital, you need to change the mind for the university and opposite and vice versa. That's why it was so inspiring for me how we can get together these two words and how we can inspire together these two words and the people just living on that part of the world, let's say. And I think my first mission was to establish the good team in the leading level of the faculty, and I think it was successfully done because I got some really good and perfect and nice person like you and other vice deans, and as well a lot of people in the medical faculty. I think this is my first mission to get together the people and let them work, because we have nice persons, many persons in the medical faculty who are doing a lot of nice work, and they need to get the good conditions to do that. And this was my first mission, and the second mission is to just improve again or push forward the medical faculty together in cooperation with these persons to be the best and the best medical faculty in the Czech Republic. I don't know who will be listening to this, but we are the best one.
We are the best. Yeah.
And I'm very proud of that. I'm very proud of the university. I'm very proud of my colleagues in the university and medical faculty, and this is what I'm enjoying. Enjoying the company of the good people and inspiring myself as well to do things which I never think that I will do. Because as I mentioned before in the beginning, this was not my dream. But still I'm trying to stay as much as possible in clinical practice. And this was the little bit challenging point that time, but I think again I have very, very nice colleagues in my department in hospital. That's why due to them I am able to do both. Perfect.
I think that you should be proud of what you achieved. So thank you for that. And could you share something that you would like to achieve in your second term as a dean, or what are your, let's say, what would you like to achieve to be content that you did a good work as a dean?
Yes, I think we have three pillars which are very important. First, for me, first is education, but not so far from this is the research itself, and also the general point of the medical faculty is very important. The things, not only the research and education, but to be a really some institution which is very important for the society as well. That's why, first of all, we are growing with the number of students. We are growing with the specific study programs, which is very important for us. For example, this year we will start with the neuroscience.
Neuroscience, yeah.
That's why you are asking me. But it's very important for us to serve as an educational institution. And this is very important that we will just educate the new generation of the people who will come to not only to the medical practice, but for science as well, and so on. And what is very important for me is that this generation will treat us. And it's our own purpose and our own
selfish,
yes, let's say, that this generation will treat us and make the medical practice for us. That's why we are selfish in this, that we would like to get the best generation this way. Also, the research and all this work is so important because it's very just close together. As you know very well, or you know, we are just building the new project here over these buildings, which will call like Biopharma Hub, and part of the Biopharma Hub will be the preclinical center. And this is a very good example what is going on with the combination about the education research, because in this preclinical center will be just not only the basic research, but the students will be just included in this research, which is very important point. And looking to the role, the secondary or tertiary role of the medical faculty in the society, which is very important, that we are serving for society as a good example how the institution could be done and how we can serve in many points of the society in a very positive way.
Wow. So wish you good luck and wish us good luck.
To you as well.
Yeah, therefore I'm saying that. I'm looking through the question that came through the system. We touched most of them, but one is pending, and this is, what was the most complicated case you ever treated? Teresa Souralova, I wanted to ask you. Can you, is something in your memory that stands out?
Maybe saying, unfortunately, it's still in memory. But no, we have opportunity to serve for Czech patients as well, but also as well for international patients. And usually the most complicated cases are coming from abroad, because if somebody in some departments abroad are not able to perform some surgeries, they are trying to send it to us. That's why usually the most complicated cases are coming from abroad. And usually there are some children who are suffering from the real big deformities with neuromuscular origin or the congenital origin. And in that deformities, you need to perform some specific techniques when you are just making some osteotomies and big changes in the whole body. That's why these are really complicated cases when you are just getting older many years in one surgery and getting the gray hairs and so on. But this is the life which we would like to serve as well for many, not only our patients, but it's also growing up with our knowing abroad of our department and so on. That's why we are open to this, and usually these cases are coming from these countries.
That's amazing,
yeah.
Your service. Okay, I think that our time is over, so I would like to thank you very much, Martin, not only for joining us today, but for serving as a dean of the medical faculty, because perhaps you don't know that, but this is really a sacrifice. This is not something that you enjoy.
Don't say to me.
The power, etc. But you have a lot of duties.
I never think about this like
Yeah. And I really appreciate what you are doing for us, and thank you for that. And wish you good luck to achieve what you want, not only in the year 25, but in the future. Thank you very much. Thank you very much for joining us.
Thank you so much for coming. Thank you.